Welcome back. I'm Mabel Jong, and I'm so pleased to have with me Dr. Jason Wu, who is now Senior Consultant at the Arbinger Institute. Welcome.
Thank you, Mabel. It's great to see you again. Great to be back. And,
yes.
and in Boston, your home city.
Absolutely,
so very excited to be here.
Absolutely. It is very exciting. And also, you're doing a presentation today that sounds fantastic. Unleash value and innovation in your organization, understanding the problem you don't see.
Right.
Wow. So, well, first of all, is it difficult to unleash innovation in an organization?
Well, we do a lot of stuff around behaviors, and you can get a lot of smart people in the room, and that's one of the things that's really inspiring, is that we have so many great, smart, dedicated people in healthcare who are trying to help fix the system. The challenge, though, is that sometimes we get in our own way and we don't see it, and that's where, and it's not because we're bad people, it's just because we get so invested in solving the problem, what we see as the problem. We don't see that other people are also at the table trying to do the same thing. And we don't understand our own emotions that lead us to actually resist innovation, or at least accepting diversity. I mean, it's the same challenge, I think, that we have whenever we're running into somebody who thinks a little bit differently than we do.
Sure. So what do you mean by getting in our own way? Give me an example.
Yeah, so, you know, there's a lot of stuff around mindset, right? A lot of different terms. Growth mindset, fixed mindset, fear mindset, systems mindset. At Arbinger, this is material I've been using for about 6 years. Mindset isn't a set of beliefs. It's the way we're alive to how we're seeing, right? Am I seeing you as a person or as an object? And we're never completely one way or the other. But sometimes we'll get into this space where we'll start feeling a little resistance, right? I'm talking to you, sharing an idea, and suddenly I'll get a sense that maybe you're not really buying it. Well, then two different things can take over. I can either start asking, well, why is Mabel not understanding? Or I can get a little bit more defensive. Well, why doesn't she understand it? And I'm asking the same question, but I'm seeing you differently. In the first way, I'm recognizing you've got needs, challenges, objectives that I don't understand. In the other side, I'm focused on, well, why doesn't she understand me? I'm more inwardly focused. And an inward mindset is what we mean when we say someone's getting in their own way. Because those emotions then create their own resistance.
Okay, so taking a less defensive approach, perhaps, in communications?
Well, it's not, so that would be a behavior, right? To be less defensive. What we're trying to encourage folks is, it's not about trying to do the right behavior, it's about trying to see differently. Don't think about Mabel as an object. Don't think about the problem, right? See Mabel as a person. If I see Mabel as a person and get really curious, why am I feeling this resistance? Is it coming from me, or is it really coming from Mabel, or is it really coming from me, right?
Okay.
That emotion is actually coming from me. It doesn't exist without you, right? So if I'm feeling resistance, if I'm getting frustrated or angry, that doesn't exist anywhere except within me.
Okay.
But then that emotion can become a problem for me because it leads to me behaving differently than if I don't have it.
Do you think this is a real barrier in the healthcare space, that there's too much of that happening all around us? So
there are a lot of inward invitations, what we call inward invitations. I'm a physician, right? We, I think, have a lot of invitations. I went to medical school for, you know, I sacrificed my 20s to be able to practice medicine. I'm the one that took a Hippocratic oath. I'm the one whose license is online. All these things are my facts, right? But I can use them in a way that justifies me not being responsive to the folks around me, not being responsive to the other folks who might have an idea about patient care, right? Or engaging them more effectively as a team. The compensation system, the requirements of providers, right? All the billing, all the checklists, all the things that get in my way are justifications for me to see my patients as objects, to see the team as objects. So at least for me, I see so many invitations that can hinder my actually being helpful to my patients or to the team around me.
It's a powerful message. Why bring it to HCEG?
So it was really fascinating. Coming out of our last conversation, I got a chance to meet with Ferris Taylor, the executive director, and I was out visiting in Salt Lake, where our company is based, and Ferris and I were able to have dinner. And just chatting with him, he was like, especially on the technology and a lot of the innovation that is happening with HCEG, it's wonderful stuff. But it's like anything, a tool, right, can be helpful if it's meant to be actually helping others. A lot of our technology sometimes is, here's my tool, you figure out how to use it. And in many ways, being the smartest person in the room is kind of the disease I like to. It's like, I've got this wonderful tool. Why can't you understand how to use it? We're not actually thinking about the physicians or who's supposed to be utilizing it. What are their real needs? And so why I think it's helpful to bring it to HCEG is they're doing lots of wonderful stuff here. Great people thinking, but it allows them to think about how they're engaging with the other stakeholders, perhaps in a slightly different way that will hopefully be more effective and more impactful.
Okay, and one of the tools that they have here is the top 10 list.
Mm-hmm.
You took a look at that list.
Mm-hmm.
What
Right.
really resonates with the work that you're doing?
Yeah, so as you know, I recently retired from government, so I am new to this private sector space, and so it's fabulous to see all the different hot topics that are up there and some of the challenges that everyone in healthcare is facing. What struck me is that 9 out of those 10 are more external factors, right? The opioid crisis, the disruptors in the marketplace, and those are things I think we all need to be aware of and smart of. But one thing that always comes up year after year is on operational effectiveness. How is my organization responding? How am I creating an agile, innovative workforce within my organization? And what I'm hoping to do is just share the insights of how I've gotten my own way and where I've seen it in my 30+ years in healthcare, and hopefully allow the participants to sort of see their challenges a little bit differently.
Are some of the things on the list clearly issues that healthcare should be making more progress with more quickly?
Yeah, so it's funny. I started my career 31 years ago in the government because I wanted to go to what back then was the Agency for Healthcare Policy and Research, ACPR, because I figured, well, that's the way to solve the healthcare problems, right? Just create standard practices, a baseline, and we'll fix it. There won't be problems with suits, right? Because everybody's practicing according to the standard of care. Well, we still have the same problems 30 years later. Right. We're getting faster at finding problems, but we still have the same basic problems. And that's where this perspective, I think, is a little bit different. Instead of focusing on the behavior, trying to enforce compliance with washing hands or pain checklists or coding checklists, let's just get back to why are we in healthcare? We're in health to care, and that means about people. And I think too many invitations of healthcare have taken us away from that for every participant, for the providers, for the payers, for the patients. We're not thinking about each other. We've lost that relationship.
Okay. Dr. Wu, what are some of the sessions you're looking forward to participating in while you're here?
All of them. I don't think, in fact, it's been so educational. It's incredible how fast the day goes. All the panelists have, it's been an education process for me. There are just so many challenging issues, and it's great to see great minds and people who are really dedicated, trying to help engage with others. So I don't think I have a good answer, Mabel. It's just a brand new world for me, and it's just been exciting to learn all of it.
All right, Dr. Wu, thank you so much for your presence here and your energy. Really
Thanks.
love it.
Thanks.
Thank
Well,
you so much.
I love being here. Thank you very much.
Okay, thanks again.